If you or someone you love has ever thought about making your penis bigger, here are 5 of the biggest mistakes that you can make if you do just that. On this video, I'm going to give you 5 of the biggest mistakes that you can make if you want to enlarge your penis. And at the end of the video, I'm going to give you a few suggestions on how you can make your penis larger safely. The most widely used surgical procedure to lengthen the penis involves cutting the suspensory ligament that connects the penis to the pubic bone. When this ligament is cut, the penis appears to look longer because there's a bit more of the penis to hang down. This can also cause skin from the abdomen to move towards the penis shaft. Now, this technically doesn't make the penis any longer, it just kind of changes some of the architecture around it. The problem is that cutting the suspensory ligament to the penis can cause the penis to be somewhat unstable. And this can be especially dangerous and even cause a major injury to the penis if the person is undergoing sexual activity. Now, cutting the suspensory ligament is often combined with other procedures like liposuctioning of the pubic area just above the penis. And it's important to realize that just because that ligament is cut, it doesn't mean that it stays separated. It can actually heal back together and re-shorten the penis at a later time. There are doctors and healthcare professionals across the country who are injecting PRP into the penis and claiming that it will make the penis larger. PRP stands for platelet-rich plasma, and you obtain PRP by drawing your blood, spinning it out and removing the platelets, and then separating those platelets with their growth factors. The idea is that because you've got a lot of growth factors in this PRP, if you inject it into the penis, it will cause the penis to essentially grow. But unfortunately, the truth is far from it. Injecting PRP does not cause anything to grow except possibly the hair on top of your head. So for this reason, I believe that injecting PRP, although it's not necessarily dangerous to the penis, it really isn't going to do a whole lot of anything. There's a case report in our scientific literature about a 43-year-old man who placed a titanium penis ring around his penis and his scrotum, and then he had intercourse. Well, after having intercourse, he couldn't get that penis ring off, and it started cutting off blood flow as everything started to swell. Well, he went to the ER to have it removed, and it was not easy to take that off. The doctor started trying to cut it using pin cutters, and those didn't work. Then they used a jiggly saw, which also didn't work, and eventually went to an electric saw. Well, the saw seemed to work, but the area got so hot that the patient started getting first-degree burn wounds around his penis and his scrotum. Eventually, they contacted maintenance and they brought a pair of industrial-strength bolt cutters, and these bolt cutters were eventually able to break this ring in 2 different places and remove it. So if you're thinking about using a penis ring to make your penis bigger, definitely don't use one that will not expand, like one made of titanium. You have a risk of strangulation of your penis and even of your ballsack. One of the most common ways to make a penis larger is to inject a hyaluronic acid filler into it. Technically, this is off-label as the FDA does not approve these injections for this use. Now, hyaluronic acid fillers last about 6 to 12 months, and it can be injected throughout the entire penis, typically through the shaft, to make the penis wider. Now, it does not make it longer, but it can make it wider. But there are doctors and nurses throughout the country who are also injecting other substances into the penis that are much more dangerous than a hyaluronic acid filler. These substances can include Bellafill and even silicone. And the problem with these permanent injections is that you can get, later on, lumpiness from these treatments. Even if it looks good initially, it's possible you can get these lumps infected, or you can get granulation reaction where these lumps get harder and harder. And you may not see or feel it as much when you're erect, but when you are flaccid, it can cause your penis to look quite lumpy and misshapen. I kind of think about the Thing from Fantastic Four, what his penis must look like, and that's what your penis could look like if you have too much permanent fillers injected into it. Got thinning hair? Don't get hair transplants just yet. Try these natural options first. Step 1 is to take a thinning hair supplement like Nutrafol. Step 2 is to use a low-light laser helmet like the iRestore. Step 3 is to condition your hair with a conditioner that contains rosemary oil. And step 4 is to dermaroll or stamp your scalp and then apply either minoxidil or topical rosemary oil. Do this and you should see thicker hair within 4 to 6 months. Always autojuvenate before you operate. More in my new book, Younger for Life. Go to autojuvenation.com or click the link in the caption below to get it. And if you pre-order it before it goes on sale, you will receive over $100 worth of free gifts. There are operations that are being performed to make the penis larger as well. Some doctors are injecting fat into the penis, which is safer than some of these other permanent fillers, but even that can cause a penis to look lumpy afterwards. But a much more invasive procedure that I would really caution you against is slicing open the penis and putting in different types of implants. Some doctors are inserting alloderm into the penis, which is essentially cadaver skin. Yes, they are putting cadaver skin into penises to make them wider. Now, these treatments do not necessarily make the penis any longer, but they can make the penis wider or basically increase the girth. The problem with these procedures is that they are invasive surgery. You can get all kinds of complications, from bleeding to infection to permanent numbness. Yes, you can get a numb penis and possibly even a scrotum after these invasive procedures. So yes, if somebody calls you numbnuts afterwards, that term can actually be very accurate. So if I'm not recommending these treatments, then what can you do to make your penis larger? Well, the first thing that you can do is you can shave your man bush. By decreasing the amount of hair that is around your penis and your penile shaft, it may make your penis look larger. If you doubt me, then just try it. Look in the mirror and see your before and after, and I bet you're gonna see that your penis looks bigger afterwards. The second way to make your penis look larger is to reduce your suprapubic fat. And this is the fatty area that is just above your penile shaft. Now, there are many ways to reduce the amount of fat that is in that area, starting with weight loss and progressing to liposuction. Liposuction can be a very safe way to reduce the excess fullness in that area and make your penis appear to be longer. Another way to improve your penile function is to improve your cardiovascular health. Now, we've been talking about the length of the penis and not so much about ED or erectile dysfunction, but one of the first signs of poor cardiovascular health, atherosclerosis, is erectile dysfunction. And the reason why is that the penile vessels are some of the smaller vessels of the body, and if they get clogged up with plaque and you're unable to essentially get an erection, then that could be one of the earliest signs that you have significant cardiovascular disease. So improving your health by exercising regularly, by eating a healthy diet filled with colorful fruits and vegetables, and by seeing your doctor and getting tested is so important and can even help you with your penile function. So these are 5 big penis mistakes, but what are 5 of the worst cosmetic procedures being performed today? These just might surprise you, but I bet you'll find them very interesting. Check them out right up here, and remember, eat real food, use clean skincare, and autojuvenate before you operate.